Hey everyone, it's Dr. Tim Whiting, Stirpe Chiropractic and Wellness Center here to present another video this week. This week we're going to be talking about common shoulder injuries, specifically the rotator cuff, what it is and what it does. So in reality, the rotator cuff is more to stabilize the shoulder joint. It consists of four main muscles. So people come in all the time and tell me they've got a rotator cuff injury, and they think it's the same thing all the time. So I usually try to specify what it is more, whether it is the actual supraspinatus muscle, which it is almost all the time, or other ones. There's one called the infraspinatus, which is a little bit lower than that one, the teres major, or the subscapularis muscle. So those are the ones that consist of the actual cuff itself, and again, those are for stabilization, keeping the shoulder tight and in there so it doesn't dislocate. It controls motion. But as far as the actual shoulder goes, there are many muscles that cross the shoulder joint. The three main ones that actually create movement are going to be your pec, your lat, which is down in your back here, and your deltoid. And so for the most part, your pec is going to bring your arm up into flexion and across. Your lat is going to bring it kind of down and back, and can adduct also across towards the back. They say that's a muscle like if you're getting arrested. It's going to come down, back, and around. That'll be the main focus of your lat. And then your deltoid itself has three separate areas: the anterior, lateral, and posterior. So that's going to help bring it up in front of you, out to the side, and a little bit of a back motion as well. So those are the ones that predominate for movement. But as far as the rotator cuff or the stability, they're the ones I mentioned earlier: the supraspinatus, infraspinatus, teres major, and subscap. So again, commonly supraspinatus is the one that's torn in a rotator cuff injury, just because of how thin it is and how vulnerable. It comes from the back around to the front and ties right into the top of the shoulder here, and again helps with a little bit of flexion, but mostly what we call abduction, bringing your arm out to your side like that. And because of where it attaches and how thin it is, it can have a predominance to tear. So that's the one we look at for that. So the biggest part of my job when you come in the office is figuring out which muscle it is that we have and what's causing your pain. So there's a lot of diagnostic tests that we're going to use to figure that out. If we can treat it in our office, we will. A lot of times it is soft tissue related, so I can do some kind of soft tissue techniques, rock taping to create some stability, decrease inflammation in the area, and get you going on your way towards rehabilitation without going to surgery, which is often what people jump to for rotator cuff injuries. So I think it's a good thing to get checked out by either a chiropractor or a physical therapist first before jumping into an orthopedic consult where they're going to want to go for surgery. We can do a lot of this stuff on your own with rehab exercises, taping, and soft tissue techniques. So that's what we have for you today, and we'll see you next week.